Hello friends, it's Carla, your online doctor, with today's Live in 5. Today is Wednesday, September 23rd at 5 p.m. So, a study from Spain finally presents the first clinical evidence for the use of vitamin D to treat COVID-19. Now, it's called a pilot study because the sample size is small, but it is otherwise a very good study design. So 76 confirmed cases of COVID-19 were randomized into two groups. Either oral vitamin D3 was given to 50 patients, or no vitamin D was given to 26 patients. This was on admission. Those that received the vitamin D received over 20,000 international units on the first day and 10,000 international units on the third day and seventh day, and then weekly until they were discharged or they were admitted to the ICU. They all received the standard of care for treatment for COVID-19 that was current at that time. So based on treatment, they all received the same thing. The only difference for treatment was this vitamin D. Now understand, 20,000 international units is a very high dose. I take on average about 5,000 international units a day by choice. The recommended daily allowance is usually about 1,000 for most people. So it's a good hefty dose, but I don't disapprove. I think it's a really good idea. Now listen up. The results revealed that 50% of the control group, the ones that did not get any vitamin D3, were eventually admitted to the ICU, and 2 of the 26 died. Okay, in the vitamin D group, only 1 out of 50, or 2%, required ICU admission, and none died. Now that is a huge difference in a small group. Okay, so 2 out of 26 died in the first group, and half of them had to go to the ICU, where the vitamin D group, only 1 out of 50. That is good. Okay, needed to go to the ICU. Remember that, none died. Both groups had similar age, sex, comorbidities, and blood markers used to measure severity of illness. Okay, and that's really important. The only difference was the control group had a slightly higher incidence of hypertension, but for the most part, they were pretty closely matched. Now, this basically shows a 93% reduction in ICU admission when given vitamin D3. That is amazing. Now, what the study does not tell us is if vitamin D could be used independently as a treatment for COVID-19, since the standard of care of treatment was used at the same time, okay? Because it's kind of, I don't want to say unethical, but I would have a hard time as a physician saying, okay, we're not going to give you A, B, C, and D, which we're giving everybody else, but we're only going to give you vitamin D3. So they put it on top of everything again, but both groups got the same treatments. Now, as most patients are usually deficient, most people in general are deficient in vitamin D, it would have been interesting to have seen their baseline vitamin D levels prior to treatment, which unfortunately was not done. So hopefully future studies on vitamin D3 for COVID-19 will include that. But as I said, most people are running low levels of vitamin D. So if you were to check your vitamin D levels, most people run on average 20 to 30. And that's if they're lucky. Driving that vitamin D level up to higher numbers is strongly recommended on many, many fronts, not just COVID-19, but for cancer and all kinds of other things, including mood and bones and lots of good stuff. So you should really be looking into vitamin D3 right now. So vitamin D3 is the type of vitamin D that you should be using to restore low levels of vitamin D. Okay, it doesn't require liver conversion and has a higher intestinal absorption, which basically makes it more bioavailable. So make sure you're not getting vitamin D2. That is not the one that is going to be beneficial to you. So the good news about this study is it is in line with observational studies that found that low vitamin D3 levels in the blood was an independent risk factor for severe COVID-19 infection. So that was like the early on information that people found. Again, an observational study is when you look back at the data to see how people who did poorly, what certain blood tests or factors may have come into play that maybe could lead scientists into areas that would help them find things like this, which could be beneficial. So low vitamin D3 also was shown to increase your risk of getting a positive test result. Okay, almost 2 times more likely. If you had a low vitamin D level, you were 2 times more likely to test positive for COVID-19. Does that mean you were more likely to get, it means basically if you were exposed, because clearly you can't test positive if you have no exposure. So if you have a low vitamin D level and you never leave your home, you're not going to test positive. For people who go about their lives and wear masks, social distance, and do whatever, but if you're exposed and you have a low vitamin D level, you are more likely, 2 times more likely to get infected if your levels are low. So how does vitamin D3 help fight COVID-19? Well, both vitamin D3 and COVID-19 target the same physiological system, the immune system, okay, as well as the renin-angiotensin system, which deals with the kidneys and water retention, etc. So recent studies have shown that COVID-19 causes bradykinin storm. Okay, we've heard about cytokine storm. This is a new one that you may want to look into. It causes bradykinin storm. So again, in addition to the cytokine, the renin-angiotensin system regulates blood pressure and fluid volume and breaks down bradykinin. So the study researchers believe that COVID-19 dysregulates the renin-angiotensin system through the interaction with that ACE2 receptor that we've talked about in the past, leading to bradykinin levels increasing. So this makes blood vessels leaky and can lead to increased fluid in the lungs and other organs. Now, vitamin D3 helps prevent bradykinin accumulation and decreases inflammation, all of which are helpful with this virus. So there's going to be a lot more information coming out on this bradykinin, angiotensin, all of that interaction. But in the meantime, the best thing you can do, increase your vitamin D3 level. I've been saying that for years, months, years. I think my vitamin D level, I'm getting mine checked in a couple of weeks. Mine is, I think, up at around 80. That's what I want it to be. I wouldn't mind it even a little higher. So a lot of the experts are saying that this is going to be the key factor, or a key factor, in keeping people healthier this fall and winter, as levels of vitamin D tend to decrease as we decrease our sun exposure. So as we tend to go indoors fall and winter, especially people who live up north, guys, start taking more vitamin D3. And if you need a good source and a really good brand, message me, because I am loving the one I take and it is doing the trick. So hope you guys are having an awesome day, and I will look forward to seeing you tomorrow for another Live in 5.